because it's horrible to know that there are people who do need help and there just aren't enough of us at the moment.
And that's the thing, isn't it? Pat Cullen is the Chief Executive of the Royal College of Nursing and joins us now from Belfast. Pat, morning to you. I think it was made really clear there with Will that, you know, the stress of this is, you know, it's not just when people aren't there, it's just knowing that the care that people want to give can't be given.
Yes, good morning, Naga. And that's what we're hearing from our 500,000 nurses almost on a daily basis, that the struggle that they're feeling, you'd have heard us coming on and talking about the exhaustion that nurses are feeling. I think what they're telling us now, it's gone beyond that. It's a sheer struggle every single day for nurses trying to keep patients safe, provide the best care that they can. And if you think of the numbers yesterday, 19,000 healthcare staff in England alone who were off with COVID. And we know that yesterday was those figures, today will be worse. And what will it be like next week? So the despair that nurses are facing and the fear and the sheer struggle that they're facing every single day will continue to do over the Christmas period, because Christmas, of course, won't be normal for them. It will be similar to last year, if not worse, is what they're telling us.
In what way will it be worse?
Well, because of the number of staff that are having to isolate, and those staff that are isolating are actually quite sick. And the reason for that being their resources are so low, going off sick because of the shifts they've been working, some working up to 14-hour days. We talked to a nurse yesterday who described her colleagues and her, and it was their 13th day on a 12-hour shift. So if you get ill on the back of that, inevitably your own internal personal resources are pretty low. So their fight against COVID is a struggle for them as well. So that in itself is building up an immense amount of pressure on those staff that are left behind.
So what's the answer, Pat?
Well, I would be reluctant to get into decision-making that lies with political leaders. But clearly something needs to happen. We need to listen to the wonderful scientific experts that we have throughout this country. And we listened to them yesterday evening and many evenings on TV and with yourselves, saying that something needs to happen in terms of perhaps a circuit breaker, and that if we leave it much longer, unfortunately, our nurses fear it will be a little bit too late for the health service. So something definitely needs to happen. We hear a lot of talk from political leaders about having a normal Christmas, and it's wonderful to have a normal Christmas. But we all know we're not living in normal times, and certainly the health service and our care home sectors aren't operating in normal times. And any nurse that you speak to would say this isn't normal trying to care for your patients in the current circumstances. So we all have to understand that normal this year isn't the same as what normal was like 4 or 5 years back. So something needs to happen to support our public, but also to support our nurses.
So, Pat Cullen, in terms of the members of the RCN, have they said to you, have you asked them before, should Christmas have been under lockdown, under tighter measures? And obviously that won't happen. And have you also asked them if they think or want lockdown measures introduced soon after Christmas?
Well, what nurses would say is that we need to do everything in our power to make sure that the health service is able to operate for patients. It's not about opening more beds, because a bed is a piece of equipment.
And I think you've made that very clear. I think you've made that very clear by talking about, and I understand your reluctance to be involved, you know, to impinge, kind of come out of your area and talk about political decisions. But let's be clear, we are talking about tighter measures. That's what we're talking about, because you've made clear it's not the problem about beds. It's about not having more people admitted to hospital. So would they say, have you asked them, have you asked your members if they would like to see tighter measures?
They would like to see political leaders making decisions that will support the health service and them to be able to do the jobs that they want to do and to be able to care for their patients safely. If that means tighter measures, that's for political leaders to decide based on the scientific evidence. And the scientific evidence is there in front of us. What I would also say, and what our nurses would say, is walk in the shoes of any nurse any day for a 12-hour shift. And I think those decisions would come fairly easy for people if they did that, particularly our political leaders.
The isolation period has been reduced from 10 days to 7 days. We were talking to Andy Burnham, the Mayor of Greater Manchester, yesterday, and talking about whether even fewer days of isolation for emergency workers, for key workers, should be introduced. Is that something that you're looking at?
Well, again, that would definitely have to be based on the scientific evidence, and the scientific experts are the best people in place to answer those questions. And if they decide that the isolation days reduce, well, then, of course, we will work to that and we'll support our nurses to work to that.
So what difference, tell me then, what difference, if the scientific evidence would help, what difference has the reduction to 7 days from 10 made, or what do you think it will make?
Well, clearly, if that was the case and based on the best scientific evidence, then it would mean that nurses and other healthcare workers would not have to isolate for 10 days and would be able to return to work quicker. But again, as I said earlier, Niga, nurses and healthcare workers are quite ill when they've been off with COVID and continue to be, simply because their internal and personal resources are low going into this because of the number of hours they've been working and the shifts they've been working, and with a very, very depleted workforce, working in a fragile service leading up to this current wave. So expecting them to come back in a shorter period of time would have to be based on an individual decision and, of course, with the best medical advice to that individual.
Pat Cullen, Chief Executive of the Royal College of Nursing, thank you very much.
Thank you.
7:23 the time now. The family of a 9-year-old boy